We're going to be talking together again about my new book, The Caregiver's Notebook, an organizational tool and support to help you care for others. This is a planner, an organizational guide, and an information keeper for any kind of caregiver, whether you are caring for an elderly parent or a child with special needs or an adult child who has some special needs, a spouse. Maybe you have a new baby and you want to use the notebook to keep track of everything medically related and legally and insurance related to your child's first 3 years of life. Well, that's what this tool is for, but I know because it's kind of thick, it's kind of big, it can look a little bit intimidating, and so this vlog series is dedicated to going through each section one by one. I'm doing one a week every Friday, and these will be posted on Into Infinity as long as the Different Dream website is here. Today we are on episode 6, and we're going to be talking about the medical information section. It is by far the biggest section of the book. It has room for the most information, and I guess that makes sense. So let's just take a look at it. You can open your notebook if you've got it with you. If not, you'll find at the bottom of this page some links that will take you to where you can order it online, or you can also order it at your local bookstore. They might even have it in stock. But if you've got your notebook, go ahead and open it, and we're going to turn to the tab that says Medical Information. And if you look at the first 2 pages, you will see, a pretty decoration and an inspirational quote or Bible verse there. And then there are some instructions about how to use this section. And of all the sections of the book, this one is probably the most important to read through before you begin filling things out, because it does have a lot of little tips in it. And even then, if you turn a page, you will notice that this section of the book actually has kind of a second subcategory tab, and you'll find those on each page because there are several different subcategories in this section of medical information. And the first one is current diagnoses, and this is just a place where you can list all of the diagnoses that your loved one presently has. And I know if you've come kind of into the middle of the caregiving situation, you may be wondering, what is it I need to put down? How far back do I need to go? And that's a really good question that I try to answer in the stress reliever on the first page of the medical information section. And it tells you to ask just a few questions. First of all, ask, does this diagnosis still impact my loved one's health? And if it does, it definitely needs to be written down, even if it's a diagnosis that was made 20 years ago. The second question is it still being treated? And if so, write it down. Is the diagnosis pertinent even though the condition has been successfully treated or resolved? And if that diagnosis has implications on your loved one's health care, even though it's not an issue anymore, it does need to be written down. So those are if your answer is yes to any of those, write down the diagnosis. And there's just, as you get each new diagnosis, just write it down in the first column. In the middle column, write down the date. And in the last column, who was the physician or specialist that diagnosed it. Following that, there's a page, 2 pages back to back, where you can list allergy and sensory sensitivity issues. If your loved one has any allergies, whether they're food related, airborne, medication related, anything, write those down along with the reaction the person has and the treatment. Is there an EpiPen? Do they take Benadryl? Does the person have an inhaler because the allergy causes an asthma type reaction? So write that information down. The same with sensory sensitivities. If there's a light sensitivity or a sound sensitivity or anything like that, it can be written on these pages. Going on, there is a page about immunizations, and this is important whether you're dealing with a child, a young child, or an adult, especially an older adult, because there are some immunizations such as shingles, pneumonia, flu shots that are maybe specific to an older person. And if you want more information on what immunizations should be current for your child or your loved one, whatever age, you can go to the back of this book and find the resource section, and in there is a link to the CDC, the Centers of Disease Control in Atlanta, and at their website they have a really good page that lists what the immunization schedules are for children and adults. So check that out if you need to. Moving on, there are some pages for dental care where you can just make a note of what happened at your loved one's dental appointment. And because this is a 3-year planner, I tried to make enough of those boxes to last you through 2 regular dentist visits a year, plus a few extras in case there's like cavities to be filled or anything like that, or God forbid a root canal. Following the dental section, it may make sense. Then there's a section for vision care where you can just write down the details of your loved one's eye appointments. Anything can go in there, regular dental eye appointments, prescriptions for contacts or glasses. If they've got cataracts, glaucoma, any other kind of eye surgery, all that can be filled in there. Then once you get that filled in, the next several pages are where you can write down information about tests and procedures that your loved one has gone through to either get a diagnosis or figure out what's going on. This could be anything from a colonoscopy to a bone density scan to a yearly pap smear, whatever you need to go down to. It could be something like a barium swallow, any kinds of tests or procedures that are done. There's plenty of room to write those down. There's room for the date, the type, who the doctor was, the body region, where it was done, that's the facility, the reason for it, the results. You can record as much as you want to help your memory when you need to look back. Once you get through the tests and procedures pages, the next section is treatment and therapies, and that's very much, it looks a lot like the tests and procedures section, but this is more, okay, what are they doing now? Did they prescribe physical therapy, and when did that begin? When did it end? Maybe there was some kind of a radiation therapy or chemotherapy if you're dealing with a cancer. There could be occupational therapy, speech therapy, feeding therapy, all sorts of different things. Any kind of therapy or treatment that your loved one goes through to deal with a medical condition can be recorded there. Again, there's room for all sorts of information: when it begins, when it ends, the reason for it, the doctor who prescribed it and carried through on it, the therapist who worked with you, the facility, all that can be listed there. And if you page through that, the last section of the section on medical information deals with hospitalizations. And this is just a real simple chart, but it can be very important because, as you know, it can get pretty tricky depending on how long your loved one, how many hospitalizations your loved one deals with. I did pretty well for a long time remembering my son's hospitalizations, but that was 32 years ago and they're getting a little fuzzy. I wish I'd had a book like this where I could have written them down. When the hospitalization was, the admission date, the reason for it, the hospital, where the hospital was located, and then the discharge date. Pretty easy information, but hard to access if you don't have it written down. Then at the end of this section, the very last page, as most pages, is just a blank page where you can write some notes if there's some things you want to remember. And of course, remember, it's your book to put sticky notes and write in the margins and any of the pages, whatever helps you keep track of what you need to keep track medically for your loved one. So that's a quick, breezy look through the section on medical information. It's probably one that you will just start filling out now. And if you don't know the history, the past history, just go, sorry, that was my phone beeping at me, but we're going to keep going here. If you don't know that history, just start where you are and start writing it down. I think I'm going to have to quit. Anyway, let's say goodbye for today. I'll check that text and see what's going on. And in the meantime, you just get started on this page and consider it always a work in progress. See you again next week when we're going to be looking at insurance information.